Thank you all for joining us. We have an exciting session from 3 of the nation's top pediatric hospitals on digital access, a new social determinant of health. Today, we are joined by representatives from Children's Hospital Los Angeles, Stanford Children's Health, and Texas Children's Hospital.
Hi, everyone. I'm Mike Katz, Executive Vice President of T-Mobile for Business, and I am excited to be here today, joined by 3 amazing panelists from the nation's leading children's hospitals to talk about bridging the digital healthcare divide and how opportunities to improve pediatric patient experiences and outcomes can be addressed by new technologies such as 5G. I think we've all seen this last year. This digital divide that we have is a crisis, and it's a growing concern in this country, limiting equal access to health care for millions of Americans. And with COVID, the acceleration of this problem, especially in rural and small towns, as well as in marginalized, less socioeconomically fortunate communities, they've been disproportionately impacted. Some 80% of America has been identified by the federal government as medically underserved. And this is an issue at T-Mobile that we've taken really seriously, including work that we do with the US Department of Veteran Affairs. Last year alone, our work with the Veteran Affairs on their telehealth app to make healthcare more accessible to veterans helped increase telehealth visits by 1,000% just in the first 3 months of the pandemic alone. Access to telehealth and innovation healthcare tools for medicine rely on reliable broadband. And according to a 2020 data from the FCC, almost 40% of people living in rural areas in the US lack high-speed broadband compared to 4% in their counterparts in urban America. But this problem isn't just a rural America problem. You see access issues for Americans living in urban areas because of lack of choice of broadband solutions, which drive up price and disproportionately impact those in marginalized communities. At T-Mobile, we believe everybody should have access, and everybody should have access to healthcare. As a leader in 5G, our nationwide network can help solve this problem and address the immediate crisis that other providers cannot. In addition to providing consumers with lower prices and more choice, 5G's blazing fast network speeds and ultra-low latency will further advance high-quality, real-time video applications that enable medical specialists to better assess patients remotely. Increased network capacity will make it possible to be simultaneously capturing data in applications like CT and MRI scans, and then follow up on those in real time. Bridging this digital healthcare divide is the first step in fostering greater health equity. This sets the foundation for delivering more advanced capabilities for patient experiences. 5G's ability to deliver a faster network speed and ultra latency also increase capacity that can unlock new medical use cases that we're already beginning to develop. For instance, T-Mobile is working with a pediatric academic facility in the Northeast to identify how 5G infrastructure can unlock a number of innovative use cases. Things such as using VR to give pediatric patients access to theme park experiences from their beds, reducing pain and anxiety. Autonomous gurneys for gurneys and wheelchairs that can track pediatric patients and remote control their gurneys and wheelchairs from a mobile device. I'm really excited to imagine the digital healthcare opportunities that 5G will enable for everyone, regardless of where they live or what their socioeconomic status is. As a leader in 5G network coverage, bandwidth-intensive healthcare applications and medical specialists can be assessed in large cities, small towns, and everywhere in between. And now I'm really excited to welcome our panelists to the discussion to share how they're navigating the challenges of the growing digital healthcare divide and the types of innovations that they're focused on leveraging to help their organizations and their patients provide better care. So please welcome me in joining our panelists. And if you don't mind, I'll go straight to a question here. There have been significant changes to the pediatric healthcare landscape during this pandemic. And one of the things I wanted to ask the panelists is, of those impacts that you've seen and the changes that you've seen, which of these are here to stay long past the pandemic? What things are going to be in place now for the future that may not have been the case if the pandemic hadn't have happened? And if you don't mind, Dr. Ward, I'll start with you.
Thank you. That is a great question. I think certainly everyone believes and knows that the adoption of e-health as an infrastructure to interact with our patients was significant. And at Texas Children's, e-health is a digital modality that we use to connect with our patients and each other. And during this pandemic, we noted that we matured very quickly in e-health. Our video visits have always been a part of our approach to outpatient and primary care for years, but 2020 took it to a different level. It became another tool, or the tool in our toolbox, not just another tool, because we had an unprecedented and a remarkable acceleration in e-health. We traditionally had 40 providers seeing 20 patients a day, visits a day, to now over 3,000 providers completing thousands of visits every day. And even our patient adoption, meeting patients where they want it to be, was remarkable. Our patient satisfaction surveys are exceeding 90% positivity on our e-health platforms and our connectivity to our patients. That was just one approach to our patient care delivery. As we innovated throughout the pandemic, we had to adopt other ways of reaching our patients. On our inpatient setting, we implemented technology in order to keep our employees and our patients safe. So we enabled video visits with our consulting services, our interprofessional team members like chaplains and social workers and child life specialists who didn't need to go into the room anymore, but still needed to provide that level of high quality care to our patients, did video visits. We had e-consults where our pediatric subspecialties performed consulting services, potentially specifically in areas where our patients were being cohorted because of having COVID-19, or in our areas where patients were immunocompromised. They did not need to go into those areas. So we had an e-consult platform that proved to be highly successful. And it also allowed our families who could not be at the bedside because of our restrictive visitation policies to still be engaged in that healthcare care coordination for their child and their family member. So those were just a few things that we felt at Texas Children's were transformational during this pandemic.
Yeah, thank you, Dr. Ward. Dr. Pagler, how about you?
Very similarly, we launched a lot of the same types of interventions and similarly saw a dramatic growth in our telehealth. So we had telehealth previous to the COVID-19 pandemic, but with the outbreak of the pandemic, we saw growth about 35 to 40x of our total volume of visits. And I think that's where we really learned a lot of lessons and understand better what will the future hold. So for example, for our developmental and behavioral pediatricians, they had not been doing telehealth visits prior to the pandemic, but obviously with everybody else jumped into them and found that they were actually able to get more information about a child's development and their possible behavioral issues when they see the child in the context of their own home. And so now going forward, they plan to do every new intake through a virtual visit so they can see the child in their home environment. Those are the types of lessons I think we're learning and are going to affect how we provide care going forward. Similarly, for pediatrics in particular, pediatric specialists are few and far between. So it's not uncommon for our patients to have to travel, 3 to 4 hours to come up for a 15-minute visit just to get a checkup of their specialty condition. And what we've really shown throughout the pandemic is that a lot of that care can be provided virtually, minimizing that disruption in the child's life and minimizing the disruption in the entire family's work and family life. So again, I think we've learned a lot of lessons and have shown what can be done, and this will continue to help us evolve to a better model of care going forward.
Thank you, Dr. Pagler. Dr. Patel, how about for you?
So similarly to what my colleagues reported here in Los Angeles, we had a tremendous rise of telehealth. Previous to the pandemic of last year, we didn't really have that much of a telehealth presence. We were actually working on our enterprise strategy. And what happened in March of 2020 is it kind of kicked us into gear, where we had done 250 visits pre-March. And then we quickly, within 3 weeks, allocated. And we have now about 26% of our entire ambulatory volume being conducted in a virtual space. So it was a commitment to ensure that we still sustained access to care, because understanding we had all of our very real fear in our communities with safer at home initiatives, this virus that's, rampant throughout our communities. And for us, being a safety net hospital is very, very important to make sure that we still align that access to care for our patients and families. So within those 3 weeks, we again were able to see our pre-COVID volumes in our ambulatory space. We also connected in our inpatient space, being protective of our patients and families and our staff. And one area that we really saw a lot of success and continue to see success is the behavioral and mental health services. Our behavioral and mental health colleagues were able to see upwards of 90% of their volume in virtual space. And this is across pediatrics, a very under-resourced specialty that we have such grave needs, and especially thinking about the pandemic, rises in anxiety, rises in depression that we're seeing. It's been such a wonderful thing that we can allocate that behavioral and mental health services via telehealth to our patients and families. And our patient experience feedback has been phenomenal. Being in Los Angeles, thinking about, traffic and geography and parking and all the things, of course, COVID has made that a little bit better, but patients really value not having to come all the way to the hospital and still being able to engage meaningfully in a virtual platform with their clinicians.
Thank you. I think all three of you would say that there's a lot more to do, but it's so impressive to hear about the progress that was made in such a short period of time. And especially in areas like this last one that you mentioned on mental health services, because you just read about so many of these, the statistics about the rise in suicides and the amount of demand not being able to match the supply of doctors. So it's so encouraging to hear the progress that's been made. I know there's a lot more to do, but it's really encouraging to hear about the progress that's been made. Another question I had for you is, I'm sure even pre-COVID, one of the things on each of your agendas was how to improve delivery healthcare tools to improve the pediatric patient experience. And one of the things I was curious on is, as you think about that strategy, what technologies have you either already implemented or technologies that you're considering implementing on your journey? And Dr. Patel, I'll start with you.
So for us, as I mentioned, our journey in virtual technology hasn't been as, encompassing for many years. It's sort of been a new space that we've been in. So the space of, remote monitoring is one thing that we're looking at, thinking about integrating meaningfully within all of our care platforms. Multidisciplinary clinical care has been a really neat space. How do you look at integrating in social work teams, care management, multiple caregivers in different areas, including school systems and whatnot, to engage in meaningful conversation about healthcare delivery for patients and families. One thing I will say is, looking at the digital divide for us in Los Angeles, it's beyond how do we even connect in a meaningful way with telehealth. Equity and access to care is incredibly important. And how do we define which visits can be meaningfully connected within telehealth, but then now how do we bring in equity in that access for all of our populations? So what we started learning is between, chat bots and sending COVID screening tools out, there wasn't much of an intake. Asking about, social emotional determinants of health surveys within a chat bot, not much of an intake there, right? So a lot of kind of cycling and quality improvement metrics and seeing what works and what not with the population. We're at a point now to ask, do you have meaningful digital connectivity? And if you don't, how can we work to help engage and align with our community-based resources? One of our local large public school systems have been working with large companies in order to bring in internet access. So we started asking, is your family in the school district? If you are, we can connect you with Wi-Fi hotspots, devices, so that we can engage in telehealth with you. We're also now looking at virtual hubs within many different community organizations, so families who don't have access can actually go to a local hub to be able to then engage in that telehealth space. So that's where we are, to see not only the future and really neat things that can come on, but even just equity and access right now.
Thank you, Dr. Patel. Dr. Ward, how about for you in Houston?
Yeah, it's very similar. In Houston, being one of the most diverse cities in the nation, it's important for us to keep this on the foresight, keep it in the lens looking forward, from an equity and equality in patient care. And so the patient populations that we serve always have to be in the center of what our purpose is. And many of our major initiatives that we have at Texas Children's around patient access, patient experience, care coordination, all align with that because of the patient population that we serve. And so we have an amazing innovation team that have several pillars of work that they're focusing on, many of them focusing on meeting the patients where they are. That is one of the main goals of Texas Children's. And so what we're trying to do is ensure that we can give the highest level of care in an appropriate from a physical, cultural, and language. As you know, Houston being diverse, we've got multiple ethnicities within our city. And so one of the things that we've partnered with, received a donation from Hearst Foundation in order to support language services. So they gave us $250,000 in 2020 to support technology and our e-enhancements in order to make sure interpretation and the improvement of the telemedicine experience was there for our patients. Because if the patient can't understand the provider and the provider can't link with the patient, then that patient, the quality of that patient care is not where it should be. And so we all know that that is a barrier for many of our patients in the area that we serve. And so that's one of the main examples that I think we are really going to continue from a philanthropic perspective to make a big difference in how we connect with our patients digitally.
That's wonderful. One just maybe quick follow-up question on that is, as you've accelerated those kinds of capabilities to your patients, what kind of feedback are you getting from patients? I mean, it's certainly wonderful that more patients are able to experience it, but what are you hearing back from your patients?
Absolutely. Our patients are telling us that because of their ability to connect and really understand, we see those outcomes in a variety of areas. We see it in the outcome of the patient, right? The patient and family knowing how to care for themselves at home because they understand what that care should look like. Our patients are telling us through our surveys, because we ask specifically, are they did they receive the care that they need, and did they understand how to care for their child at home? Those scores are very high when you think of our interpretive services. And I think that makes a big difference because they need to understand what we're telling them in order for them to deliver the care to their child at home or the woman, because we take care of women and children here at Texas Children's.
Thank you, Dr. Ward. Dr. Pagler, how about for you?
Yeah, I think we're all struggling with the same topic, so very similar answers here. We also, when we looked at our data early on in the pandemic, realized some significant disparities, and we had a much smaller portion of our Spanish-speaking population engaging in telehealth than was engaging in in-person health. Similarly, our numbers of Medicaid patients engaging in telehealth was much lower than our insured patients, and that's just scratching the surface of the the disparities. And so we're doing several things to try to mitigate the inequities and to improve the experience for all of our population. So similarly, language is a major issue, and we rolled out integrated interpretive services within our telehealth platform, which is a huge advance. We also recently rolled out closed captioning, which helps not only with folks with disabilities, but also with the multiple languages, because being able to read the text at the same time that they're listening can help with understanding. But we know that there are still challenges there. Similarly, while broadband access has improved, I think, as you said, Mike, early on, there are still significant issues, not only in rural areas, but in our urban areas. There are lots of children and families who don't have good access, and we're really struggling with that. We've been somewhat lucky in that many children have had access to devices through their school, but may still have poor internet access. So we've done some creative things, like we had a child who was a diabetic who was having multiple readmissions for decompensation for DKA, and his mother also had disabilities and had real trouble traveling. And so we worked with the school and set up telehealth visits with the school nurse and the child and an interpreter and the mother all at the school. And so they had good internet access to the school, and then school nurse was able to help facilitate the visit and to support the child in school. And I think those are the types of creative things that we're going to have to continue to think of going forward to really, again, meet patients where they are and meet their needs in a way that works for them.
You know what, we've talked a lot about reaching people that don't have broadband and haven't had access to these tools. And you know, one of the things that I wanted to ask you about is what are the healthcare concerns? You know, we've talked a lot of people just not having access. What are the concerns that you have as a healthcare provider with people not having the access? And as you think forward, what emerging technologies are you the most optimistic about that can help solve some of these issues? And Dr. Pager, will come back to you to have you start.
And, you know, I think as a country and, you know, as healthcare advocates, we need to continue to advocate for better access and better access, you know, both broadband access and then access to devices, and really getting these basic telehealth tools to our patients, and to all patients is a first immediate need. And in many ways, the most underserved populations are the ones that have the most trouble getting to a visit at baseline, and then for them to be further disadvantaged by these digital divide issues, I think is just a tragedy. So I think continuing to work to advocate for solutions there and partnering with schools to figure out solutions. You know, I do think in pediatrics in particular, because those subspecialists are so few and far between, I am excited about some of the advanced digital health tools like remote monitoring that we can continue to roll out to create kind of more supportive, continuous proactive care instead of that reactive intermittent care. So, you know, for example, again, with our diabetes population, we've been trialing multiple different modalities where instead of the traditional models of care, we are providing an iPod to every patient at diagnosis, getting them set up with continuous glucose monitoring and having that data upload directly to our EHR where the endocrinologist can see it, and then alternating every visit between inpatient, in-person, and virtual, so that the child doesn't have to come in as often, and virtual check-ins. And I think this modality of care and this research that's going around it will really help us find the most optimal types of support for our children so that these chronic diseases don't disrupt their lives in the way that they have historically. Again, I'm super excited for this technology, but I'm also very aware and very concerned that this may exacerbate the digital divide. And so I think we need to be really thoughtful and creative about how we make these tools available to all children.
I think it's such a great and important point. Dr. Patel, what are your thoughts?
I couldn't agree more with everything that Dr. Pager just reviewed. I think if you ask me what the biggest thing I'm always concerned about, it's always access to care. I think the wonderful thing that virtual and the technology has brought is so much opportunity and flexibility to that access. You know, that example about alternating visits, whether they need to be in person and virtual, it's such an amazing win for patients, families, staff, everyone alike, to then also think about resource limited services like pediatric subspecialty and beyond to be able to serve more children and families would be extraordinary. I worry about the basics of that equity is really it. One heartbreaking just example in rolling this out is that we had one of my clinics that had a patient family enrolled into a virtual visit. And during the visit, our clinicians noticed that a wall behind the family looked familiar. The family came to the hospital to connect to the Wi-Fi to do the virtual visit. And the clinicians thankfully recognized, wait, the family is here, pulled them into the clinic. But that right there tells you from the beginning, we have to understand how deep this divide is and what are we doing here and how can we stunt up the population, whether it's devices, more broadband coverage, when families are calling different companies, making sure there's equity and language availability. We know in Los Angeles at times waiting on the phone for Spanish language is much longer than English speaking, thinking about the complexity of how expensive plans are. So I think it's all of that work together. I do think the future is extraordinary of what we can do, bringing in that flexibility to access. But I think the very foundation needs to be looked at.
Yeah, I totally agree. Thanks for sharing that story. I mean, you see the pictures of kids sitting in the Taco Bell parking lots, taking the Wi-Fi to do school. It's just heartbreaking. And to the point that you made earlier, it's not just in rural areas. It's our biggest, most developed cities in the country, and it's got to be addressed. Dr. Ward, what are your thoughts?
Yeah, I agree with my colleagues. I think the digital divide has all of us concerned. When you think about the social determinants of health and how families don't have the resources and the needs in order to care for themselves, it is concerning as a healthcare provider. I do believe that that is one of the focus areas that we've got to really partner on when you think about how getting technology and getting care via technology to these families that otherwise don't have the means. And one of the areas that I think Texas Children's is our health plan, which is a health plan focused on the underserved population. They had an example of leveraging technology to combat the digital access by sending care at home kits and partnering with our health plan, where these kits are provided for patient monitoring devices for postpartum care to moms who otherwise may not have that level of care because of their lack of access or availability of technology. And so it is concerning. I think we as healthcare providers need to be very forward thinking, be very collaborative minded in that mindset in order to come up with a solution for our communities and for our population who don't have access readily to them.
I can't help but think that there's a lot of people watching this that are really passionate about this issue and or are leaders at companies, including technology companies, that are passionate about this issue. What would your advice be to people that want to help on how they can help you and your missions that you're driving in your institutions?
I think for me, this is the tip of the iceberg. I think we are going to revolutionize healthcare. And I think about healthcare of the future. This is where it's going. In order to care for the millions of people who need it, we have to be innovative. Our patient population will desire care in their community, not coming into a medical center such as TMC. And so we've got to have a variety of ways in order to deliver that care. So I would say to those adopters of technology and partners in technology is to partner with us, come to the table to help us advance medicine and along with technology together in order to change healthcare of our community.
Dr. Pagler Patel, any other thoughts on how people could help?
Yeah, no, I totally agree, Dr. Ward. I think absolutely this needs to be a partnership, and there is so much excitement and so much opportunity to improve healthcare for children. But there are a lot of unique characteristics and needs of children that are hard to understand until you work with, the folks that are working with them every day. And, everything from trying to figure out how to address these barriers that were a barrier at baseline and are even more pronounced in the digital world, to thinking about, some of the complications around pediatric proxy access, and you're not just dealing with the child, you're dealing with the parent or the guardian as well. And there's some real complications in how technology interacts with that, and thinking about the pediatric data privacy, to thinking about adolescents and the adolescent privacy needs that are unique to that particular population, and really developing technology that can appropriately secure their data, so give them secure access to confidential care. So there's so many unique and fun and challenging and important needs in pediatrics that we're all looking to partner to develop solutions.
Absolutely. I would just echo all of those statements. Happy to partner always and build this delivery models together. We know in this field, thinking about social emotional determinants of health with anything, we think of healthcare as 30-40% and everything is all of the rest is, community collaboration, organization, everything. I think all of the really neat, cool, innovative things coming on board in the future, it's so exciting, but always keeping in mind the lens of equity in that, and how do you promote and engage and think of those things from the beginning as you're designing these elements, so that you're able to provide these resources for all. And thinking about it wouldn't be just serving a certain population, but how do we then mitigate and think about all of these challenges, these foundational challenges that we see, and how can we overcome them together?
Well, I just wanted to thank the three of you, not just for participating in this conversation, but much more importantly for the work that you and your teams do every single day. I can't think of more important work than taking care of our children. And it always puts things in perspective for me when I think about what you guys are doing and then measure that against the stresses that I have every single day. So I just can't tell you how incredibly thankful I am. I also am just so appreciative to hear the passion about closing some of these equity gaps that exist. And I think we can all agree that healthcare for every child should not even be a question. And every child should have access to the same kind of healthcare and healthcare solutions that everybody else has. So I'm so appreciative of the passion that each one of you are driving through your organizations to do that. And I hope that there's a lot more the collective we, everybody that's listening, this can do to support that mission. So thank you for a great conversation. And thank you again so much for everything that you're doing.
Thank you.
Thanks, Mike.
Yeah.